White and Pharoah's Oral Radiology. Principles and Interpretation, 9th edition, edited by Ernest W. and Lam and Sanjay M. Mallya, was published by Elsevier in 2026. The book belongs to the field of oral and maxillofacial radiology and is intended for dental students, postgraduate students, dentists, and specialists. The authors present it as an introduction to the entire field for students and as a comprehensive resource for more advanced readers. The subject is important because contemporary dentistry cannot separate diagnosis and treatment planning from the appropriate selection and interpretation of diagnostic imaging, while every use of ionizing radiation must provide a clear clinical benefit. The book is logically organized. The first section explains physics, the biological effects of ionizing radiation, and radiation protection. The second covers image receptors, geometry, intraoral and panoramic imaging, computed tomography, magnetic resonance imaging, nuclear medicine, ultrasonography, radiographic anatomy, quality assurance, and imaging prescription. The third addresses the principles of interpretation and the radiologic manifestations of caries, periodontal diseases, abnormalities, inflammatory changes, cysts, neoplasms, trauma, diseases of the sinuses, temporomandibular joint disorders, and salivary gland diseases. And the final section covers implant dentistry, digital planning, artificial intelligence, and forensic applications. The sequence is one of the book's major strengths. The reader first learns how an image is produced and what its limitations are, then when it should be obtained, and finally how it should be interpreted. Chapter 16 is particularly strong because it does not reduce interpretation to memorizing the appearance of lesions. The authors recommend assessing image quality, systematically examining the entire image, and, when abnormalities are identified, analyzing their location, borders, internal structure, and effects on surrounding tissues. They place an understanding of disease mechanisms ahead of simple pattern recognition, which is didactically powerful because it develops diagnostic reasoning rather than memory alone. The scientific foundation is strong but uneven. The book uses original research, systematic reviews, meta-analyses, guidelines, and documents issued by professional organizations, and the bibliography in several sections extends through 2023 and 2024. Older classic sources are justified for physics, anatomy, and fundamental principles, but they become more problematic when they determine rapidly changing rules concerning imaging selection and radiation protection. The most important clinical message of Chapter 15 is that imaging must not be used as a substitute for medical and dental history taking and clinical examination. The choice of imaging method should arise from the patient's medical and dental history, clinical findings, the specific diagnostic question, and the treatment objective, with an assessment confirming that the anticipated benefit outweighs the radiation risk. The authors also recommend obtaining previous images to avoid unnecessary repetition, while imaging performed solely for administrative purposes, without benefit to diagnosis or treatment, is considered unjustified. This position is highly convincing and consistent with a contemporary individualized approach. The second important recommendation concerns the selection of imaging modality. For teeth and supporting tissues, intraoral radiography remains the primary method when high spatial detail is required. Panoramic radiography provides a broader overview but has lower resolution and is affected by distortion and superimposition. Three-dimensional imaging is not presented as superior simply because it is technologically more advanced. Cone beam computed tomography should be used when two-dimensional images do not provide the necessary information, when the examination may provide new information, and when its use is individually justified. The field of view should be limited to the area of interest. In endodontics, the book retains intraoral radiographs as the first-line imaging method, while limited field cone beam computed tomography is recommended in cases of unclear symptoms, complex root canal anatomy, suspected vertical root fracture, failure of previous treatment, and selected surgical situations. The reasoning is sound, but the cited joint position statement concerning endodontics dates from 2015. An independent review shows that the American Association of Endodontists and the American Academy of Oral and Maxillofacial Radiology published an updated statement in 2025 that supersedes the previous document, and this section of the book should therefore be read alongside the newer recommendations. The third important area is radiation protection. In Chapter 3, the new edition states that lead aprons are no longer routinely necessary and that, in pregnant patients, an apron does not protect the fetus from internally scattered radiation. The emphasis is instead placed on justification of the examination, appropriate collimation, correct positioning, and dose optimization. This is independently supported by recommendations issued by the American Dental Association in 2024, according to which routine use of lead aprons and thyroid collars is no longer recommended. However, Chapter 15 reproduces a table of guidelines from 2012 that still recommends protective thyroid collars and aprons whenever possible. The same book therefore reproduces an older recommendation in one section while correcting it elsewhere on the basis of more contemporary evidence. For an edition published in 2026, this represents a genuine editorial weakness, probably related to the interval between manuscript preparation and publication, but the practical consequence remains. More importantly, the American Dental Association and the American Academy of Oral and Maxillofacial Radiology published new recommendations in early 2026 concerning patient selection for two-dimensional radiography and cone beam computed tomography, explicitly updating the guidelines from 2012. For this reason, recall imaging intervals and protocols presented in the older table should not be used uncritically as current clinical guidance. The fourth area of practical value is the diagnosis of caries and periodontal diseases. The authors require clinical correlation of radiographic findings rather than automatic treatment decisions based solely on imaging. In periodontal disease, they recommend imaging as an adjunct to the clinical detection of disease and as a method for evaluating and monitoring osseous support. The fifth useful message concerns implant dentistry and digital surgery. Three-dimensional planning and surgical guides improve predictability, but they are not completely accurate, and appropriate safety margins in relation to vital structures must therefore be incorporated into treatment planning. This is an example of a responsible, non-promotional approach to technology. The book's greatest strengths are its integration of physics and biology with clinical decision-making, its systematic methodology of interpretation based on disease mechanisms, its exceptionally rich radiographic and three-dimensional material, its strong emphasis on justification of exposure, quality assurance, and clinician responsibility, and its inclusion of digital planning and artificial intelligence without assuming that technology can replace professional judgment. The authors, for example, emphasize that artificial intelligence models require large, appropriately labeled data sets, which provides an important counterbalance to uncritical technological optimism. The weaknesses include the breadth of the book, which limits the depth of certain subspecialty topics, the absence of formal grading of evidence quality for each recommendation, and the inconsistent currency of some guidelines. For students, the book is excellent because it builds a logical progression from fundamental principles to interpretation. For young dentists and general practitioners, it is highly useful because it teaches when imaging should be performed, what a particular modality can demonstrate, and when a patient should be referred to a specialist. It is likely to be most useful to postgraduate students in oral and maxillofacial radiology and to clinicians in disciplines that rely extensively on diagnostic imaging. For specialists and educators, it remains a strong reference and teaching resource, but it cannot replace the most recent guidelines in their specific areas of practice. The three most important professional principles are these. Radiographic examinations should be prescribed according to the individual patient rather than according to a routine protocol. More technology does not automatically mean a better diagnosis, and the least burdensome method capable of answering the clinical question should be selected, and good interpretation requires systematic analysis and integration of the image with the biology of disease and the clinical findings. Does the book deserve a place in a professional library? Yes. Particularly for students, postgraduate students, dentists who frequently interpret radiographic findings, and educators. It may be unnecessary for a colleague who is looking only for a brief protocol for a narrowly defined procedure and who already relies on current specialist guidelines. Its greatest value lies in the way it teaches clinical reasoning through diagnostic imaging. Its greatest weakness is that some protocols become outdated more rapidly than its anatomical and diagnostic core. It is best regarded as a comprehensive textbook and reference resource rather than as a current clinical guideline for every decision. Is it worth the time required to read it? Yes, if you want to understand not only what you see on an image, but also why the image was obtained, what it can reliably demonstrate, what it may conceal, and how its findings can be translated into safer clinical decision-making.